Welcome back, everybody, from the break. I hope you're having a good virtual conference thus far. I'm very excited to have a large group of panelists to talk about this this final session, to have this final panel and get lots of perspectives from around the world. So I guess I do want to, obviously thank our sponsors, UPS and Chemonics, for supporting this. I hope you've had a good experience so far in the conference, and I think it's been great that even in this time of COVID, we can convene together and continue learning from each other about how to improve supply chains, and especially how to improve the supply chains that help us deal with the pandemic itself. On that front, I'm really excited to have this opportunity to have a panel to focus on the important role of essential workers. And obviously this, in a health and humanitarian conference, we have a lot of focus on the healthcare workers, and they are at the front lines of responding to a pandemic. But I also want to open up the conversation, especially at a supply chain conference, to all the other essential workers that are behind the scenes in making sure that those products are available to the health workers to deal with the pandemic, and also to provide the other essential services in society that need to still happen as we're in a crisis. So I'm excited to convene this panel on this topic. So we want to move forward to the next slide. So we originally convened a panel of 4 experts from different countries. We're going to add in a couple of voices because, we're not limited due to a physical stage with a number of chairs. So we're going to also call on a couple of additional voices during this panel. But we'll definitely start out with, and we'll get perspectives from various countries, which I think will be really helpful in seeing how each country has been dealing with the pandemic and providing support for essential workers to be safe in performing their important roles. We'll be featuring work from Mozambique with VillageReach and Ruth Bechtel, the country director there. Dominique Zwinkels will talk about the role that people that deliver play, and I'll let them all introduce themselves more fully when they make their presentation. But they played a role across supporting various countries and various organizations. We'll also hear from Lloyd Mbasela from Zambia, the Industrial Training Center in Zambia, highlighting the important role of drivers and making sure that they can be safe during the crisis. Kathy Fulton, the Executive Director of the American Logistics Aid Network, or ALAN, is an organization that provides support to lots of different supply chain actors across different sectors in crisis moments. And we're also going to hear from a couple more people, and Dominique will say a bit more about this grand challenge of supporting last mile supply chains during COVID. Ruth and VillageReach and Lloyd from ITC are 2 of the awardees, but we also are inviting 2 other awardees from GreenLight Initiative in Nigeria and from SafeBoda in Uganda. And we'll invite them in to share their experiences on what they've been experiencing during COVID and what the projects they have going forward. So I'm excited to hear from all of these different countries and different roles that people play in the supply chain. We did have a poll at the beginning to try to help frame a little bit the audience in terms of what is an essential worker, and it's interesting that only 4% of you are an essential worker, but a lot provided support, and hopefully I was hoping to see 100% thanked essential workers, but we've hopefully started realizing that this role of essential worker is broad across supply chains, and there's a lot of people we need to support. One of the big things that's a focus during this pandemic was the role of personal protective equipment. So I was curious up front to hear this topic of PPE, which again, primarily is utmost importance in a healthcare setting, but also applies in other industrial roles to make sure that the spread of the disease is not facilitated across workplace settings. And it's interesting, so that very few people had ample supply throughout 2020. So we know that was an issue. It's interesting that a lot of people had frequent but brief shortages, and a few people had some prolonged shortages. Different experiences with accessing PPE during the crisis. And that's obviously going to be a key part of what we'll talk about here is the protective equipment required by different essential workers in the crisis. But I do want to turn to that there's more than just PPE. Workplace safety is more than PPE. It's also the practices that you enable to prevent the spread of disease. It goes beyond the equipment. That's a big part of it, but there's more to that. So we'll hopefully have a broader discussion around all of the things that these different actors have been doing in different countries to protect supply chain workers. So with that, I want to start with some short presentations for each of the panelists to briefly introduce themselves a bit more fully, and also to share a little bit about their role during the crisis here. So if we could stop sharing this screen, I'll turn over to the presentations here. And we'll start with Dominique Zwinkels from People That Deliver, which has had a global perspective in supporting lots of organizations and helped convene this grand challenge to provide support for supply chains that are specifically playing important roles during COVID. So I'm going to turn it over to Dominique to share a bit more about what they've been doing during COVID.
Okay, thank you, Jarrod. And hello, everyone. Good afternoon and good evening. My name is Dominique Zwinkels, and I'm the Executive Manager for the People That Deliver, PTD for short. This initiative was established in 2011 when 79 institutions came together at a World Health Organization conference, and they pledged their support and action towards strengthening the capacity of the health supply chain workforce, and also, of course, promoting the professionalization of the supply chain role in the broader health system. That was a really important element of our initial start. So we found that although hundreds of millions of dollars of commodities were flowing through the country's health supply chain, often the critical strategic function of the supply chain was not acknowledged. We also saw then, and is often still remains the case, that the health supply chain workforce lacks the technical and managerial competencies to perform optimally, or even the empowerment to affect supply chain decisions and policies. We see that in many low to middle income countries, that there's an insufficient number of adequately trained staff, and particularly logistics staff, to manage health supply chains. And so for us, the professionalization is very critical to embedding a workforce with specific supply chain competencies in the health system. And that's why we always talk about advocating for a systematic approach to human resources for health supply chain management. And I've put down in the slide here that our one goal is to create a competent, supported, and adequately staffed supply chain workforce that's deployed across the public and private sectors within the health system. So today we're a global coalition focused on providing technical leadership in HR for SCM, a very specific niche, not just SCM, not just HRH, really a specific niche. And we're governed by coalition members, and you'll see those organizations on this slide. They represent 7 different constituencies, from donors and aid agencies to implementing partners, academics. We have Jarrod from MIT on our coalition, and also excited that we have a new chair and deputy chair that we just elected this week. Lloyd from Pharmaceutical Systems Africa, and Jenny Froome from SAPEX and Avon Management. Jarrod, next slide, please. So I just wanted to provide you a little snapshot on how we see protecting supply chain, the supply chain workforce as essential workers. And as you know, that's really our opinion, that they are essential workers. So we're providing a platform to organizations to share their innovative approaches so that the entire supply chain community can benefit. And at its core, we really are a knowledge hub for best practices in human resources for supply chain management. And we think that with COVID-19, we are at the right time to bring together our community to discuss sort of the changing landscape and the processes of what this change means, to the, the long-term effect on the supply chain workforce. And so we've curated, so we've selected, organized, and presented specially tailored content relevant to the supply chain workforce on our COVID-19 resource webpage, which I have here on the slide. And here you can basically find information on human resources, workforce-related resources, resources related to research, to the supply chain itself, training and tools, online communities, and such. We have also developed a 4-page brief, which is also available in French, on the essential health supply chain workforce, and outlining sort of key considerations and suggested resources to keeping supply chain workers safe and supported throughout this pandemic. On our website, you'll also find that we've held a number of webinars with our coalition partners. The very first one was with Chemonics International, and the second one was with SAPIX, and we're looking to do more of these just to showcase the need to keep supply chain, the supply chain workforce as essential workers, well protected and safeguarded. Let's see, so next slide, please. And so I wanted to speak to you today a little bit about the Grand Challenge. In April of 2020, we were so graciously awarded a grant from the FIA Foundation, which is an independent UK registered charity that promotes road safety, and who wanted to contribute resources to the COVID-19 response efforts. And so with this funding, we launched the Last Mile Health Supply Chain COVID-19 Support Program Grand Challenge, a mouthful, which provides seed funding to promising projects in sub-Saharan Africa that address health, commodity, transportation, and logistics challenges brought on by the pandemic, of course. We search for organizations with innovative, high-impact ideas, looking for financial resources to help those ideas come to life. And we selected 4 projects with very much an emphasis on promoting and reinforcing sustainable workforce development. Normally we talk about recruitment, retention, but in this case, of course, it's very much about protecting and safeguarding the workforce during COVID-19. And so I just wanted to, I highlighted the 4 different organizations here on this slide. The very first one is the GreenLight initiative, which is a nonprofit based in Nigeria. They have a mandate to improve road safety, logistics, and transportation safety in Nigeria. Their Grand Challenge project will focus on safety training for truck drivers, transporting medical supplies, and ambulance drivers transporting COVID-19 patients. The training will help to ensure that drivers can protect themselves from contracting COVID-19, also enforce and advocate for COVID-19 safety protocols as they perform their jobs, and ensure that COVID-19 supplies are delivered to hospitals in a safe and timely manner. They are partnering with the ambulance transportation systems for COVID-19 response in Nigeria under the Federal Ministry of Health's Hospital Services Department, which was developed as a new sort of supportive standard during COVID-19. SafeBoda is the next organization. They're operating in Uganda, and they began as a motorcycle ride-sharing service. The company has since expanded to not only provide safe rides for people, but also deliver health products directly to customers' doors. The Grand Challenge will support the scale-up of SafeBoda's Safe Health Initiative, which aims to support their 1+ million low and middle income customers to stay home safely and to access quality healthcare products to prevent the spread of COVID-19. In the short term, this initiative will help maintain the daily earnings of more than 22,000 motorcycle drivers and medical facilities and pharmacies during the pandemic. It has the potential for scale up to more users and communities as a long-term solution for reliable access to quality medicines and health products provided by, of course, qualified pharmacies. The third organization is TransAid. They're also on our coalition, and they will collaborate with the Ministry of Health in Zambia to develop training content specific to the challenges faced by professional drivers. Working with their local partner, the Industrial Training Center. We have Lloyd here today, based in Lusaka, and have satellite centers in the Copper Belt. TransAid will engage with transporters to ensure up-to-date and accurate information on COVID-19 based on current national guidelines. The Grand Challenge funding will also be used to develop a training module and will be integrated into the training that is already provided to both public and private sector companies and individuals that are learning to drive trucks and forklifts to ensure a level of preparedness to COVID-19, which is now embedded within the sector. And then finally, VillageReach, which is also a member organization on our coalition. They have been supporting the Democratic Republic of Congo in implementing a streamlined supply system through the next generation of supply chains. And then with the help of the Grand Challenge, they will ensure that community health workers in the DRC receive PPE that they need to maintain routine services by integrating the PPE donated into already well-functioning transportation system and supply chain. The project will provide logistics workforce with the information and training that they need to respond to additional demands on the supply chain during the pandemic. And so that's it for the Grand Challenge. And so back to you, Jarrod. Thank you very much.
Thank you, Dominique, for providing an overview of the role that People to Deliver has been playing during COVID. For those of you looking at the chat, I posted the link of the COVID-19 resource page that they put up. So I would definitely encourage you to take a look at that if you're looking for those kinds of resources. And leverage the important work that People to Deliver has provided to curate those resources. And then the nice thing is she's just talked about these new awardees of this new initiative, and she gave a basic overview, but we get to hear from each of them now of what they're doing, what they have been doing thus far in COVID, and what their initiative is going forward. We'll start with Ruth Bechtel from VillageReach. She's the country director for Mozambique for VillageReach. And again, they're the essential workers that come to the forefront for all of us as the frontline health workers and those community health workers. And they've got a special role to play in providing that support. So let's hear from Ruth and their work in supporting the community health workers, essential workers during COVID.
Thank you, Jarrod. So as Jarrod has said, my name is Ruth Bechtel, and I work for VillageReach in Mozambique as a country director. In this role, I also support our supply chain globally, and so I'm a co-lead of our global supply chain work. So VillageReach has been operating as an organization, a global health organization, since 20 years ago, and we started here in Mozambique our work. So 2020 was our anniversary, 20 years anniversary. So our mission is to transform healthcare delivery to reach everyone. And so in the last 20 years, we have been working in partnership with the governments in the countries where we are, as well as private sector partners and other actors in the health sphere, to ensure health products are available to people when and where they are needed. Apart from an office in Mozambique, we also have 2 other countries where we have offices, that's Malawi and DRC. And our work intends to increase quality healthcare And we are reaching over 43 million people across sub-Saharan Africa with our interventions in supply chain and other interventions at last mile. In Mozambique, our work began with supporting the Ministry of Health to improve their vaccine supply chain, focusing on the last mile, of course, as I said earlier. But more recently, this work has been expanded to the broader supply chain of medicines. And along with 4PL companies such as Bolloré and Agility, and in collaboration with other Ministry of Health partners, VillageReach supports an integrated supply chain, ensuring that products are made available where they are needed and when they are needed. These partnerships with private sector in collaboration with other partners are very core to our work to ensure success and to ensure sustainability. So basically, we provide technical assistance really to strengthen government systems in supply chain, which is the area that I'm focusing on today. But we also do other activities in last mile to increase access to quality healthcare. So on the onset of COVID-19, VillageReach joined efforts with the Ministry of Health and Ministry of Health partners for a collaborated response. This included ensuring that COVID response supply chain needs are integrated into our work in supporting the Ministry of Health. It also included supporting the Ministry of Health with procurement and distribution of PPE to essential workers. The earlier speakers and Jarrod in his introduction has touched on the PPE issue. And our focus mainly in procuring PPE was for community health workers. Next slide, please, Jarrod. So, as we know, and we agree here that community health workers are essential workers. We do, though, see that they are often not represented in national procurement numbers. And when stocks are limited, they are the last ones really to receive. And this is not because they are not necessarily prioritized, but because the priorities are competing with who needs to get PPE first. The procurement challenges caused by a high global demand for PPE resulted in delays in shipments to countries, hence delays in getting community health workers adequately protected to continue doing their work safely. Following a drop in access to protective gear in Africa, there is a 203% increase in COVID-19 infections among healthcare workers, and this is according to WHO data. This in already acute health care worker shortage, such as ours in the region, is a shock to systems that don't have much room to absorb such a shock. So for many communities, as in our region, community health workers are the only connection to primary health care services. And yet, due to lack of PPE, sometimes in some countries, they're being told to either stay home or keep working without protective gear, which exposes them to being sick. So VillageReach partnered with Direct Relief and other global partners for an initiative that is called CAF Africa, which is raising up to $100 million to supply PPE to 24 African countries. And this PPE is estimated to cover them for approximately 1 year. Next slide, please, Jarrod. So, CAF Africa unites over 30 partners to plan, procure, and distribute PPE to community health workers. And this requires an effective end-to-end supply chain, which in end calls for the protection of supply chain personnel. So during this period of COVID, we have been juggling with ensuring that community health workers have their PPE, but also ensuring that the supply chain workers who are going to make that PPE arrive timely to these community health workers so that they can continue doing their job are themselves safe. And so VillageReach has been, as we work with the Minister of Health, with the supply chain team, we have been also looking at how to support where we see gaps in PPE, for example, for government supply chain workers, but also as we work with private sector companies, we have also been working with them to see and ensure that their own employees, the smaller companies that are involved, are also safe. So I'll end there for now.
Thank you, Ruth, for sharing what VillageReach has been doing and how they've been playing a role. I mean, we often hear about collaboration, even this morning, about how can we improve collaboration, and while we should always strive to do that, we should also acknowledge at times when the collaboration is working. I think it's really impressive to see how VillageReach has worked with the government and with the private sector like Bolloré to bring together initiatives, and then the CAF Africa collaboration to provide PPE. Again, these are good examples of really useful, practical, and impactful collaboration that's happening. So let's also remind ourselves to acknowledge the success we are having on that. Those of you who know me know I have a passion for drivers. They play an important role in our supply chains. So I'm particularly happy to invite Lloyd Mbasela from the Industrial Training Center in Zambia to talk about the role that they play in supporting drivers during COVID-19 and what they're doing going forward. So Lloyd, please join us in sharing more about your experiences.
Thanks, guys. Thanks, Jarrod. My name is Jason Finch. I'm a project manager with Transit. I'm just going to stand in for Lloyd Mbasela while we try and reconnect him. Okay, so Lloyd Mbasela is the executive director of the Industrial Training Center in Zambia. That's ITC. ITC was established nearly 35 years ago, and it is Zambia's premier vocational training center for the manufacturing and transport sectors. In Zambia, COVID-19 cases have sharply risen since July, and the situation is negatively impacting professional drivers, especially freight transporters working in Zambia and throughout the neighboring region. Some measures taken by the government to control the spread of COVID-19 have resulted in deteriorating working conditions for our professional drivers. And in addition to the risk of being exposed to COVID-19, there is now a real concern that the risk per journey is also increasing as professional drivers are becoming more stressed and fatigued. And if I could have the next slide, please. In Zambia, the definition of the essential worker is still a little unclear. However, when the government introduced social distancing and travel bans, professional drivers, including cross-border freight transporters, were allowed to continue, and we took that as a signal that they are deemed essential. This is because they are needed to maintain the essential supply chains, including the delivery of medicines and PPE. We've now begun a project to build the resilience and the future preparedness in our health supply chains in Zambia. And for this, we will be developing Transit and ITC, a new communicable diseases training module, and then training 100 of medical stores' limited employees engaged in various levels of the health supply chain. And the final slide, please. So ITC and Transit will be collaborating on this. I'm with Transit. We're a UK development organisation, and we've partnered with ITC since 2008. Transit, we will be bringing to this project recent knowledge and learning from delivering a project to sensitise and equip with PPE truck drivers working in Uganda, allowing them to better manage their risk while continuing to work through the pandemic. You can actually view the materials developed for that project by texting hi to the WhatsApp number that's actually on your screen now. Also, further information and resources can be found on Transit Knowledge Centre by visiting the web address also on the screen. And I'll leave it there and hope that Lloyd will be able to restore his connection and rejoin the panel. Yeah,
that is unfortunate. That's one of the downsides of the virtual conference, is that we are susceptible to technical challenges. So we do hope Lloyd can join us and again during the question and answer time to provide his perspectives, unique perspectives on the ground there. On that front, on questions, I would note that please start adding questions during these presentations that we can be ready for an active question and answer session later on. We have a few set up to talk about as a group, but we want to hear from you as well. Moving forward, we have a couple of organizations, and I'm going to flip back on slides here to the one that Dominique presented. We don't have slides for these organizations, but we have representatives from SafeBoda and GreenLight Initiative. And so we'd like to hear a little bit more from them without slides, but talking about what they've been experiencing during COVID and what they're planning to do going forward, what their ongoing role is on last mile health supply chain support. So I'm going to first turn to Francesca Hine from SafeBoda as the head of food and shop there. I have to admit that I have been a user of SafeBoda myself for transport in Uganda, and they provide an important service for moving people, but also goods, and the drivers that support supply chains there using motorcycles and other sources. So I'm curious to hear, beyond the very useful public service you provide in transporting people, how you're helping support supply chains during the COVID crisis.
Cool, thanks Jared, and great to hear that you're a user of SafeBoda. Hi everyone, so I'm Francesca, I'm head of food and shop delivery at SafeBoda. So as Dominique mentioned, SafeBoda is a consumer platform that aims to revolutionize transportation, payments, other on-demand services in Africa's cities. So we basically believe that everyone should have access to affordable on-demand services at the click of a button or tap of a phone screen. And we have 1 million plus customers in Uganda. We have about 20,000 boda drivers, which for those of you not familiar are essentially motorbike taxi drivers. And ride sharing is really the core of our business. So that's how we built our customer base, launched in 2015 with a couple of our co-founders and a association of boda drivers. And we are now what we say a super app. So we launched other products and services on our app since then. In 2019, we launched a cashless payment system, and in early 2020, we launched a food delivery and a shop delivery service. So in Uganda, Uganda has about 8,000 confirmed cases and only about 75 deaths, but has had one of the strictest or most stringent lockdowns, let's say, in the region. So, you know, cars, public transport, gatherings, etc., banned and faced a lot of curfews. And what that meant for a lot of, you know, the informal sector, and including the boda sector, and obviously our drivers, meant that, you know, we could no longer be providing rides to customers, and drivers no longer had an income. So what we did essentially during COVID was to double down on our food and shop delivery business, and we've really been able to I think protect and support essential workers in a couple of ways. You know, firstly, we were able to keep these drivers working. We were able to provide health deliveries on health products, food products, other essential items to customers, and grow those deliveries, delivering to customers' homes, meaning that our SafeBoda drivers were able to keep working throughout the lockdown and keep bringing in an income. The other thing we did as well was, you know, in doing this, we were able to keep working a lot of our vendors. We have over 500 vendors on our platform, vendors who are working, you know, informally in the markets, vendors who are in our cloud kitchens, cooking meals to sell, pharmacies who we've onboarded onto the app. And we were able to support these guys as well during COVID, when otherwise, you know, given there was a complete lockdown in the country, they would have no other way to carry out business. And what we also were really able to do was to scale these services very quickly with the help of our various partners. We partnered with UNFPA, UNICEF, for example, to really scale these products and able to increase the impact of our work very quickly. The other thing I wanted to mention as well was, given our network of delivery drivers and our customer reach, we've been very involved in rolling out and communicating SOPs on COVID-19. So we're part of the task force for the Ministry of Transport and the Ministry of Health in Uganda, and have been able to, roll out a lot of communications about to our customers and to our drivers about, basic health precautions, and also to roll out to distribute products such as masks, sanitizer in fuel stations, etc. And we've been very excited to be part of the Grand Challenge as well. And as Dominique mentioned before, as part of the Grand Challenge, we were really looking to scale up one part of our delivery service, which was the Safe Health initiative. So we're already providing, health products to our customers. We've distributed 100,000 condoms, sold 500 plus other drugs, distributed to our customers during lockdown, and are really working to scale that service. And onboard about 150 new pharmacies and expand the reach of our customer base. So really excited to get going on that and working with the team there.
Thank you, Francesca, and thanks for highlighting the important role of home delivery and engaging people, reaching people in various ways. There's been I think almost every country has seen a big shift in how far our supply chains are extending in new ways in delivering directly to people's houses and providing services in new ways. And so our last mile supply chains are really growing and expanding, and thanks for your work on that front. I did put some links to further information on several of the initiatives in the chat session, so you can follow up and read more about those. I also want to highlight too, another thing you said that I thought was really helpful is remembering that the drivers, have a livelihood as well. And so enabling them to go to work enables their livelihoods to be supported at a time when, economic conditions are challenging due to COVID. So it's an important role, not only in providing services to consumers and reaching people, but also enabling livelihoods to happen through continued employment. So I now want to turn to another one of the awardees from the Grand Challenge. Simon Patrick Obi is the Executive Director of GreenLight Initiative, and Dominique mentioned a little bit about that before, but Simon, are you with us, and can you share a little bit more about what you're doing during COVID?
All right, thank you so much, Jarrod, and thank you to everyone. My name is Simon Patrick Obi. I am the Executive Director for GreenLight Initiative. GreenLight Initiative is a non-profit that is based in Nigeria. We currently work to promote transportation and safety. We're happy to be shortlisted for the Grand Challenge. Our project is titled Safety Training for Truck and Ambulance Drivers. And the reason for this project is this. We realize that some of these drivers, truck drivers and ambulance drivers who are responsible for the movement of hospital logistics supplies, are not well equipped. And these issues were further compounded since the advent of COVID-19 in Nigeria. And it was becoming a big problem because we saw increase in the number of, increase in number of people infected, especially among these supply chain workers. And we thought there is a need for us to bridge in the gap and do something. And so our project, we hope to empower these drivers and assistants with basic safety protocols for them to be able to, first of all, protect themselves, as well as advocate for safety measures among others. So we are organizing this training in 6 locations within the 6 geopolitical region of Nigeria. And we are training 60 drivers in each of the locations. In total, we're training 360 drivers. And we are working closely in collaboration with the Federal Ministry of Health and then other partners in implementing this project. Yes, that's brief about our project, our program. And again, we're based in Nigeria, and we're happy to be working with PTD in implementing this project in Nigeria. Thank you.
Thank you, Simon, for sharing this important work that you're doing in featuring the important role of safely providing last mile services to support the health workers and ambulance services and so forth. It's obviously an important to be able to have continuity of our health supply chains to the last mile throughout a crisis like this. So I'll turn at the end here. So we've covered the 4 awardees here, and again, this is by no means all of what's innovative and happening in supply chains in various countries around the world, but hopefully it gives you a flavor of some of the really important work on last mile supply chains during the COVID crisis. I want to instead turn now to some work in the U.S. Learning from each other's experiences is important, and Kathy Fulton at the American Logistics Aid Network has been playing a role for a number of years in enabling various companies, mostly focused with the private sector, helping them to be able to respond to domestic and international crises, but has played a specifically important role in helping all of these different private sector actors come together and ensure the capacity of these private sector supply chains is maintained safely as all these resources are needed during COVID. So Kathy, would you like to share a little bit more about your experience supporting the private sector and supporting all the different important supply chains during COVID?
Yes, thanks, Jarrod. I appreciate the opportunity to speak today, especially when, the real work, I feel sometimes I'm not doing the real work, but the organizations you're talking that are on the panel here are the ones who are on the ground doing the real work. And so our organization helps to support those groups. Just very quickly about Allen, we work with a lot of nonprofit organizations, helping them coordinate their logistics response, specifically through relationships with the private sector. We provide educational activities to help advance that knowledge. We provide information on supply chain risk. I'll talk about that a little bit at the end. And then mostly what I want to talk about is this convening of cross-sector conversations, really to help us gain a shared understanding of what's really happening. And I'm going to talk specifically about an example that wasn't necessarily cross-sector, but cross-industry. So next slide, please. So we were formed after Hurricane Katrina here in the U.S., and we were formed by industry to support humanitarian response. And we have, a number of association partners that we work with, and you can see those logos that I have posted here. Each of these groups represents either individuals or companies who have some role to play in the supply chain. Logisticians, transportation, warehousing, material handling, manufacturing, everything really end to end that is required to move products from their initial source to the consumer and back again. And so what we found early on during the pandemic, probably this started for us in the U.S., these conversations around mid-March, was that each of these groups was doing something, right? They may have been lobbying, or they may have been trying to help their members, or they may have been trying to figure out what their response needed to be. And because we already have relationships with these groups, we said, let's see if we can pull everyone together. Let's get all of our brains in one space so that we can do this collaboratively. We don't need, all of the supply chain associations, all of the transportation associations going individually to Homeland Security and advocating for, their role as essential workers. Let's make sure that that we talk about it together. And even if they are going with their individual advocacy arms, let's make sure that that message is consistent. Along those same lines, each of these groups and their members, the businesses and individuals that comprise them, were creating their own protocols for how to keep their employees safe. Whether it was, the truck drivers who now needed face coverings to go into stores to make deliveries, or if it was retail workers who needed plexiglass shields to protect them, to help distance them from shoppers. Each of those organizations, associations, and businesses were crafting these on their own. What we said is, there are similar roles across the supply chain, across different industries. Let's talk about, let's information share. And we got these folks together weekly for first 4 or so months, and now we meet every 2 weeks. We talk about what resources are being created, how do we share those resources. All of these groups who probably compete for membership whenever the sun is shining and the sky is blue, found themselves in the position to really need to learn from one another and the desire to share with one another all of their strategies that were being created. And so it turned into, I know David Sarley asked something about, cold chain and protecting cold chain workers. Absolutely, the Global Cold Chain Alliance has done a huge amount of work on that. Well, they've also shared that to IWLA, who is typically, works with dry goods warehouses. Same thing that may go to home delivery, that may go to, general warehousing, that may go to transportation. There are lessons to be learned across all of that. Our role was simply to convene them, to have those conversations, to help protect those essential workers. Next slide, please. Along those same lines, there was a lot of information, and I'm just going to hit on this quickly because I know we're short on time here, but each of the states within the U.S. and even different counties and jurisdictions were creating their own list of non-pharmaceutical interventions that they wanted to utilize in order to help combat the spread of the virus. What that did was created a lot of friction within supply chains. And those non-pharmaceutical, the implementation of those non-pharmaceutical interventions was often done without consultation to industry or to any pre-existing supply chains. So we, in addition to helping with that advocacy, we also put together what we call our Supply Chain Intelligence Center, which maps each of those non-pharmaceutical interventions that has the ability, or that will either cause friction, either keep supply chains from working optimally, or help to improve their the flow of freight, by waivers or whatever. And so, that was just another way that we wanted to help make sure that the goods that needed to get to market, whether it was, food to the grocery store shelves or the food banks, PPE to hospitals and clinics, whatever it was, it needed to get to where it was needed, relies on supply chains, and that relies on information. So we just wanted to help kind of facilitate that. And I think I'm going to stop there so we can get into the Q&A portion.
Thanks, Kathy. It's definitely all the different associations. I have to admit, I learned about a lot of associations I didn't know existed, during this crisis of different, roles that associations play in supporting various actors in the supply chain and how they need to come together to have a coherent, consistent approach to safety across the supply chain workplace, but then also how that extends to the map and how different jurisdictions and how the governments need to work together too. So this is a complex challenge. to think about workplace safety across supply chains that span jurisdictions for various sectors. But I think we've hopefully learned a lot of lessons to build on going forward to be able to mobilize these efforts more quickly during crisis.
Down, up and down. I hope it will hold. The question shows that we have a situation where mostly transporters or truckers are getting marooned at the border towns due to a number of issues that I'm sure Jason mentioned in my presentation, that drivers are subjected to a 14-day quarantine before they could be allowed to proceed where they are going. And we have very serious congestion of trucks and people in the border towns. And to that effect, we came up with the position of seeing how best can we communicate to these vulnerable but very important people in the supply chain, that we need to give them the information they need about how to protect themselves against the spread of COVID-19. And partnering with TransAid, we came up with a training package which is going to help disseminate information for the medical stores employees, that will be 100 of them, and also provide them with the PPE that is going to help them really protect themselves as they carry out their very important duty of distributing medical supplies across the country. Because medical stores is the only government institution that is mandated to distribute medical supplies, and they are very vulnerable with the pandemic. So I think our moving in will help them to really understand how to protect themselves as they carry out their duty.
Yeah, thank you for that, that further explanation of the challenges that drivers face and the important work to coordinate the efforts with the government and others to ensure that the trucks can keep moving and we can avoid the backlog of trucks like we see there at border crossings, and that we don't have drivers idled unnecessarily because we've been able to provide proper precautions for them to stay safe while doing their work. So that is very much important work. Actually, at this point, I want to switch to the Q&A session a bit more, and I'll stop sharing my screen now here, so we can hear from everybody. But also at the same time, I'd like to launch a poll. It's kind of a long poll, but I'd like to hear from the audience on various fronts on the challenges that they've experienced directly or indirectly with their partners regarding workplace safety. So if we could launch that poll as we're going into the Q&A session. It's a bit long, so you'll have some time to look through it. But I'm really curious to hear how your organization or your direct partners, what challenges they face. It's multiple answers, so I'd like to hear everything that's going on in terms of challenges you face with workplace safety. But I'll first turn to, I have a few questions for the panelists in general to discuss. And the first one is kind of the role of the government. It's alluded to by several people. In first of all, defining essential workers. How are they defined? And Ruth mentioned something about community health workers, making sure we can incorporate them in that definition. The way to incorporate drivers of various kinds. Lots of different essential workers. So how were they defined by the government, and how did that evolve over time? And then what support did the government provide for essential workers in terms of guidance or clarifying standards and regulations? And maybe even prioritization of resources to support the essential workers. So maybe a little bit more discussion in each of your countries, how you experience the role of government in both defining essential workers and providing the support for them. And maybe we can start with Ruth from Mozambique to talk about that experience.
So from our experience here in Mozambique, essential workers in the health sector were defined beginning with, you know, the frontline workers that needed to be prioritized for PPE, but also other health workers were included in that prioritization. But you know, I want to give an example of how sometimes this prioritization can forget some people that are crucial, and maybe they're not necessarily in the health sector, but in a sector that will impact supply chain. You know, as part of the CAF Africa Community Health Worker PPE initiative, there were supplies that arrived at the end of June to the international hub in Johannesburg, but they did not get into the country of final destination until August. It took over a month because a key player in the supply chain, in this case a custom official, became sick. And the shipment sat in South Africa until the receiving country had this critical resource to receive and check in the shipment. So this is the implication of what happens when an essential worker gets ill. And so there is a ripple effect after that down to the community level as community health workers, healthcare workers that are in the health facilities may not get their PPE supplies. And so I think that, you know, the experience that we are going through now together with the government and other partners is showing us that prioritizing sometimes goes across sectors to make sure that the supply chain is functioning and there's a collaborative you know, supply chain between different sectors that are involved in ensuring that commodities arrive where they should arrive.
Yeah, that's an important point, highlighting the role of customs, and there's so many touch points. We see it's almost like a you know, Pandora's box. When you start defining essential worker, you realize that there's related roles that are needed to continue, more essential workers that are required to support the supply chain. So I wonder if Lloyd, Francesca, or Simon would have another perspective from Sub-Saharan Africa on the role of government in defining essential workers. How did that roll out? Was it clear? What did it evolve? And what was the support that they had for essential workers? Do you have anything to add to that?
Yes, I think I have some clues I want to share. For us in Nigeria, the essential workers were classified just like Ruth mentioned. The essential workers are those who work in the hospital, and also those who work in the security sector, and then some persons who work, some people who work within the food industries. You know, during the lockdown in Nigeria, these are the only persons that were allowed to move freely. You know, and so they gave them special tax. I mean, you must have to get a tag for you to be allowed to move around, you know. And again, in addition to the earlier submission I made regarding why our training in Nigeria, you know, so what happened during this period was that we saw that the workload for supply chain workers was huge, and the level of support that the government can you know, give to these workers was minimal because of the limited resources. And so it further created a problem within the system, you know, so which is what we are trying to solve in collaboration with the government. So yes, essential workers fall between the those who sell food, those who are responsible for transportation, and also the medical workers. Thank you.
Yeah, thanks, Simon, for sharing that experience about how that's played out in Nigeria. Lloyd and Francesca, do you have anything to add? about the experiences in Zambia or Uganda or East Africa?
Yeah, I mean, I can add on from Uganda. I mean, quite similar actually to Nigeria. Essential workers were really defined as anyone working in health services, food markets, and transport really. And again, you know, same case, they were, unless you were one of those workers and you had a sticker or a permit from the government during peak lockdown, you were not allowed to move around at all. So very, very restricted there.
Kathy, maybe you could talk about the experience in the U.S. I know there was a moment that the White House Coronavirus Task Force talked about it from the White House briefing about the important role of essential workers across the supply chain. But tell us about the evolution to that realization in the U.S.
So you're right, Jared. It has been an evolution, and it's built on a number of pre-existing frameworks. So, you know, we have the national critical functions, critical infrastructure that is defined typically by our Department of Homeland Security. When they first started out, you know, it was pretty basic. You know, it's only people who work within those critical sectors supporting critical infrastructure. It has expanded. That definition has continued to expand based on advocacy work that you know that I talked about earlier. But it does, you know, it talks about the industries that are being supported. So, you know, medical and healthcare, telecom, you know, IT. But it also talks about workers who are needed to support those industries. You know, Jared, you probably recall at one point there was this big concern about maintenance workers, right? Because they are a critical input to support those industries. But maintenance workers were not at one point deemed essential. Well, so who's going to repair the forklift so that they can load the food onto the truck to get it to the market? So it has been an evolution. Thankfully, you know, there has been better conversation between private and public sectors. But you know, I think the early misunderstanding of who was deemed essential probably led to longer or more friction in our supply chains than had we just had the conversation at the beginning about why you really need certain components, certain roles.
And hopefully this is a wake-up call for governments around the world to be able to have a better understanding of the supply chain and how complex the support of essential workers are across the supply chain. And, you know, I mean, each state in the U.S. had to learn differently, then the federal government learned differently, but countries across the world, hopefully we as a profession can help the government better understand this role. I don't know, Dominique, do you have anything to add to that and what you're seeing in terms of the definition of essential workers and what's happening more globally?
Had to unmute myself. Yeah, no, absolutely. I think in our opinion, you know, the health supply chain workforce really are essential workers. I mean, they're there to procure and deliver these supplies that are just so essential in the fight against this pandemic. And I think what we keep forgetting as well, you know, there's going to be a need to detect, you know, fraudulent medicines in the marketplace as well. And we need to make sure that we have the workforce for that. So it was important for the prevention, detection, and also responding to shortages, right? So we know that there's been challenges with the movement of goods across the global supply chain, air, sea, land, etc. But also the operating environment is very complex, and so that all impacts the workforce. And in that respect, we're seeing them as essential, very essential to this.
So if we, in defining these essential workers, I'm going to try to blend in some of the questions we're seeing online here with something we were going to talk about. You know, PPE, we mentioned it in that survey up front. You know, we try to define workplace safety so that PPE is a last resort, but it often is an essential thing that you need in order to provide workplace safety. So there's a couple of questions about how to deliver PPE, even the definition. Julie Swan has a question about the definition of homemade masks for PPE and how they can be used. maybe talk a little bit, do you have different perspectives on your experience with PPE in different workplace settings, and how has that been defined and how has it been provided? And maybe we can start with Ruth again, because she's had a bit of a focus on that with VillageReach, and then others can join in.
Yeah, so how is PPE defined? So the Minister of Health here gave guidance in being supported by WHO and other partners to provide the necessary guidance on who needs what type of PPE. But I think that the main issue really around PPE was not so much how it's defined as it is to getting it to the people that need it. And I think that you know, the whole you know, challenge with you know, shipping PPE into the country and you know, getting it you know, made it so that it's difficult for PPE to arrive and get to the people that need it. But in Mozambique, for example, partners of the Ministry of Health joined hands and provided support to the Ministry of Health, and there was adequate support to ensuring that the numbers are you know, are correct for procurement, but then it was hard to get it quickly into the country, and so other partnerships you know, played a role in getting the PPE to the country. For example, you know, our collaboration in the CAF Africa with the World Food Program to use their infrastructure, the supply chain infrastructure capacity was super valuable in moving products globally during this time. And so I think the collaboration among global players is really critical, as well as collaboration between the multiple departments in the Ministry of Health and with the partners in the country to ensure availability of the proper PPE. So for example, you know, but we do have, like, you know, certain concerns with government, for example, in Mozambique around the sustainability of providing, you know, adequate PPE to health workers, looking at, you know, we are not, we're in a marathon here, and so there's the concern of, like, will we be able to actually keep pace with this and sustain the provision of PPE as needed. And so there has been a situation whereby, for example, cloth masks are being, you know, looked into as an alternative for community health workers, for example, who are not working directly with patients or close contact with patients.
Yeah, and that's an important point there, is that defining the usage and prioritizing when there are scarce resources on PPE, where the most, you know, different levels of protection are most important to deploy. And, you know, as Julie's mentioning, there's places where cloth can be an alternative, maybe not ideal, but helping to shape the demand consumption to align it with if there are scarce resources on PPE. And there's been a lot of discussion of PPE, and I definitely encourage you to follow up with the CAF Africa initiative on that. Getting close on time here, I want to come to, we have a question from Walter Proper, and I think he's ready to ask it as a group, getting back to drivers, which I love to do. So Walter, you want to ask your question?
Yes, sure. Thank you, Jarrod. To all of the people working for and doing transportation training, so my question is, what is your follow-up to check that training took effect and they're still not driving like bats out of hell when they're going down the road? So just what is that training? What is that follow-up to the training that you all are doing? Thanks. So I guess for all of you, so I don't know if we want to.
So it could be Lloyd or
Yeah.
Jason, Simon, Francesca with Bodas.
Firstly, I ended on talking about how essential workers are considered in Zambia. Like everyone has said, most importantly, essential workers are considered from the point of Ministry of Health personnel, the medical personnel. But when we had the lockdown, truck drivers were allowed to move, which means that they were considered to be essential workers as well, because they were given that opportunity to transport goods, mostly medical supplies from border areas from other countries into Zambia. Hence, would say they are also considered as essential workers. But when there was that lockdown, it was up to a certain organization to identify who could be the essential workers and allow them to continue reporting for works. Chain stores personnel were still working, and also few government employees in strategic ministries. But most importantly, the ones that everyone knows as essential workers during this pandemic period are the medical personnel.
Thank you. And what about the role you're playing with drivers and the follow-up to ensure that the training you're providing is continuing to be supported going forward?
Drivers really continued to support the supply chain, and despite operating under very difficult situation because of not having adequate support, since they were not recognized officially as essential workers, they had very little support in terms of what could help them to carry out their duties safely. Otherwise, drivers continued doing the supplies, the deliveries.
Is it okay if I just add on to Lloyd's response there?
Jump in, yes.
Thanks, Lloyd. Lloyd. This is actually a conversation that Lloyd and I have just had the other day. It's a really good question, Walter. You know, how do you ensure that the learning, the skills transfer is permanent, or that it's adopted and it's applied? One of the things that we're particularly aware of at the moment going into COVID is to make sure that there isn't that COVID fatigue. So that is that, you know, recipients of training or recipients of new instruction don't see this as a temporary measure or something that is just, you know, for a matter of weeks or months, but is actually taken on board. How do we make sure that that is adopted long term? How is it sustainable? Really working at the organizational level. So a lot of the training that we've done with TransAid, working with training institutions, has been to bring in trainee drivers for refresher courses or new drivers for starting over, and actually instilling the skill set within them. Obviously, our approach in Zambia is working with the organization at the organization level, bringing in, you know, senior managers, fleet managers, operational staff, and make sure that not only are the recipients of the training able to, you know, not only are the recipients absorbing that training, but then their managers and the others involved in the organization are allowing them to apply it. So just really bringing it in at the organizational level is kind of our approach here. But it's a really good question, and it's something that during a pandemic, during, you know, something that's focused on the health supply chain, is really important to just be conscious of moving forward.
Yeah. And the need to continue training is out there. David Sarley posted an important question looking forward to vaccines and ultra cold chain and training that might be required for drivers there. And I know, Jason, you answered directly there, but the work for supporting drivers to conduct their work safely will continue to evolve, and the adaptation will be required going forward. So we're out of time, unfortunately, but hopefully, for me, this has been really good to hear from perspectives of groups working in various countries. Supply chains are the same everywhere, but the unique context in which they're having to operate and the requirements they have to support essential workers are different, but I think there is a great benefit from learning from everyone's experiences in different countries. I'm thankful to the direct on-the-ground work of groups like VillageReach and SafeBoda and GreenLight Initiative, and the supportive work of groups like TransAid and Allen and People That Deliver. We as a supply chain community still have a lot to do in this crisis, and then also in learning from this crisis to make our supply chains even more robust and resilient to crisis. So it's strange not to have applause, but let's all applaud for each other and the work we're all doing as a sector, and move forward in terms of enabling all those important essential workers that are out there. Thanks for taking time to share your important experiences in that journey.